Hi, this is Scott Miller. Welcome to my Top Performance blog, and I am here with Shirley Galdis, Bob Moneysmith, and Elaine Ring. And you guys work for?
I work for the Crawford Marion Alcohol, Drug Addiction, and Mental Health Board.
And Bob?
Community Counseling Services.
And Elaine?
Marion Area Counseling Center.
Okay, and I have been coming here now for a couple of years.
Yes.
2 years.
And you've been implementing client-directed, outcome-informed clinical work. You are using an automated, a web-based program for tracking outcomes. We've spent the entire day talking with the staff about their clients, etc. We did an interview a while back, probably 6 months ago when I was here, about everything that you had experienced, in particular about implementation. But Bob, you were mentioning that there was some new research that you had done, and I was wondering if you'd be willing to share that.
Well, very simply, our accountant at our agency has been looking at this and comparing current numbers to numbers a year ago, and we've noted a 18% increase in productivity per full-time equivalent when comparing those two.
Okay.
We believe that's due to the improvement in cancellation failure rate of clients.
And what's that due to? Why would fewer clients be canceling or
Well,
no-showing?
As the name implies, it is client-directed.
Yeah.
Clients feel like they have a larger piece in their treatment, a larger hand in their treatment.
And so you're using this across programs?
Yeah, we use it for case management, alcohol and drug treatment, as well as our mental health counseling.
And if you all had to put your finger on 2 or 3 things at this phase of implementation, it's now part of how the staff works. You routinely review these charts. I know because I've been part of that review. 2 or 3 things that have made your implementation process successful at this point. What would those 2 or 3 things be, do you suppose?
For us, I think one of the largest things is administrative buy-in. You know,
Okay.
from our board of directors, our executive director, all of our supervisor staff, everyone subscribes to it and believes in it. And then another thing would be our partnership with the Adams board, you know, our primary funding source.
Okay. So both the funders and the administration is on board.
Right.
Was there something else, Shirley?
Well, I think that to do this, we really needed your help
Okay.
and your support. And
Thanks for that.
And having my outcomes, because we are able to see the graphs immediately. We get immediate feedback. We're able to give the client immediate feedback about, you know, what their scores are and what that might mean to them.
Okay.
But I think the Adam Board allowing us financially to do that in terms of they kind of reduced a little bit of the productivity. Like today, the training day, is not hurting us from a financial standpoint to be here. And that allows us to really reinforce it's not just an add-on to the staff.
Okay.
They get to come to a day like today and really talk about it, so it's not just another thing they have to do. They get, I mean, we meet at one point every week. We would meet to talk about CDOI and staff cases. Now we're down to every other week.
Okay.
But that was what you call the administrative buy-in, and we had to invest time in it and tell them we were willing to invest time, and then I think it helps them actually use it and not just see it as something else they have to do.
And I guess as I travel around and talk, especially to public sector service providers, this is a big deal. They've already got a lot of paper, a lot of oversight, a lot of regulation. I'm so appreciative of being invited to talk with you and work with your crew. It's such a pleasure.
Thank you.
All right. Thanks.